Welcome to Ask Dr. Mingle, the Q&A series answering your questions about quality programs and the transition to value-based care. My name is Hadley Taylor, a MIPS Quality Program Consultant, and as always, I'll be hosting this episode with Dr. Dan Mingle. But today, we're going to have a fun twist on our usual episode format. CMS has released the 2023 final rule, and there's a lot to unpack. At Mingle Health, our team of experts works hard to keep up with all the new rules and regulations for each performance year. So for this episode, we thought it would be great to let our subject matter experts, our SMEs, share their knowledge with you. We'll start this episode with Dr. Mingle's overview of the significant components of the 2023 final rule, and then Dr. Mingle will introduce our SMEs one at a time. They'll answer questions about MIPS Value Pathways, the APP transition, and more. Dr. Mingle, before our experts join us, can you share your overall reactions to the final rule for 2023?
Thanks, Hadley. It's an interesting rule that's rich with strategic renewal. Medicare reminds us that they want all Medicare beneficiaries in an accountable care relationship by 2030. They also remind us that the quality payment program was set up to introduce providers through MIPS to value-based care, value-based payment, and to encourage participation in alternative payment models. The MSSP, that is the main shared savings, the Medicare shared savings program, was designed to slowly introduce participants to shared savings and shared risks. Medicare shared with us in this rule some measures of success in both programs, but there's still some difficulty for some specialists to find meaningful measures. There's problems with benchmarks that participants are finding that they're ratcheted down to unattainable savings in later years in the MSSP. In this rule, health equity shows up in measurement and rewards. There are new health equity measures and improvement activities. Health equity measures are given high priority measure status. The area deprivation index is introduced on a 1 to 100 scale that's calculated by census block. And APP participants are offered a bonus based on, in part, a high area deprivation score. A new low-revenue ACOs are offered advanced investment payments based also in part on the area deprivation index of assigned patients. This rule announces new and reconfirms previously existing strategic directions. Not only are MVPs introduced into general availability for 2023, but there is a shift in expectation that development efforts will go into MVPs rather than into traditional MIPS from now on. And CMS intends to sunset traditional MIPS. Medicare has us trying MVPs in voluntary subgroups for 2023, 2024, and 2025. Then 2 more years, that is 2026 and 2027, of voluntary use of MVPs, but mandatory subgroups to use them. 2027 is currently the proposed sunset of traditional MIPS, with 2028 being full-on MVPs. And CMS reveals an intent to put MVPs to work in ACOs to recognize and reward specialty contributions to high-value accountable care. On the MSSP side, there are big changes in benchmarking to attempt to remediate the ratcheting effect of always having to beat your own benchmark, and suggestion that the future may be administratively set benchmarks to ensure reliably different preferential payment for reliably high-value care. Medicare is extending the glide path and permitting ACOs to linger indefinitely at lower levels of shared risk. Medicare doubles down on the intent to stick with the APP program, citing a legislative requirement that quality standards get more strict year to year. They are sticking with the APP course, at least for now. They extend availability for 2023 and 2024 of a relaxed quality standard to early users of APP, ECQMs, and MIPS CQMs. They are also offering a health equity bonus that I mentioned before to upwardly adjust quality scores of ACOs for caring for greater numbers of disadvantaged patients, based in part on the area deprivation index. Interesting, the only practices that will qualify for this are those who are submitting the APP as an ECQM or MIPS CQM. Interesting, if you're looking forward to digital quality measures, there's no new work toward digital quality measures mentioned in this rule. The only time the issue comes up in this final rule is as a routine disclaimer on all new measure activity. So keep an eye on MVPs, APP, and MIPS CQMs, health equity, and Medicare shared savings plan benchmarking. These are all heating up to be year by year changes. Thanks, and let's move on to our subject matter experts. We welcome now Kevin Wheaton from Mingle, who's our subject matter expert on the cost performance category of MIPS. Kevin is a quality program consultant for us, and it comes with a long and varied career in leadership and engineering in a variety of industries, and has been with us for quite a while now. Welcome, Kevin.
Thank you.
So let's get started. Let's ask first, how, Kevin, is the cost category going to change in 2023?
So in 23, cost is going to change minimally. The biggest change I see is there's going to be a bonus, up to 1% bonus for improvement over your 22 score in cost. So I don't see any huge changes this year.
So there's a set of cost measures that have been created for traditional MIPS, and now there's new cost measures being created for MVPs. How will that play out in the decision whether my group is going to submit an MVP or submit in traditional MIPS?
Any new measures that are created for MVPs will also be available for traditional MIPS, as long as you meet the case minimums. Those measures, you'll be subject to them. So it may be beneficial to be part of an MVP to reduce your exposure to cost measures.
So are you saying if I'm in an MVP, I'll only be subject to the cost measures that go with that MVP?
That's correct.
And then, is there a way to know what cost measures will apply to my practice? It's hard to predict my score or understand where I need to put efforts if I'm not sure which measures are going to apply.
Yeah, so we've developed what we call our cost analyzer, which will help you see which measures you're subject to, how many cases, that sort of thing. It doesn't work for all the measures, but it gives you a good idea for most of the measures. And the other thing you can do is look at your 22 feedback report, and the measures that you were subject to in 22 will probably apply in 23.
That sounds like great advice. Thanks, Kevin.
Thank you.
Now we have Lisa Morin with us as our subject matter expert on promoting interoperability. Lisa is a quality program consultant for Mingle. She has 20 years or more in healthcare, a lot of that time in quality reporting, risk management, quality and performance improvement. Welcome, Lisa.
Thank you, Dr. Mingle. It's nice to be with you today.
Good. I've got a couple questions about promoting interoperability. The Cures update to EHR requirements has been around since 2015. I understand that's finally being going to be felt at the user level this year. Can you tell me about that?
Sure. So the 2015 Cures update is something that healthcare EHR systems have been having in the works and actually should have updated by December 31st of 2022. So that means for the 2023 reporting period, your vendor should have updated your system, and you need to make sure that that has happened and also that you're using the functionality within that Cures update within or by the start of your reporting period in 2023. So if you have any questions about that, you certainly want to check in with your vendor about that updates and make sure you have everything in place that you need.
Thanks, Lisa. That's a good warning. And are there any changes in who needs to report promoting interoperability in 2023?
Yes, for many years now, CMS has automatically reweighted a number of different clinician types. So they are continuing with reweighting for some clinician types, but they're discontinuing that automatic reweighting for four specific types. So if you or your group has providers included that are nurse practitioners, physician assistants, certified registered nurse anesthetists, or certified nurse specialist, those providers do need to report in 2023 as part of your group, or if they're reporting individually, they need to report promoting interoperability. Um, Keep in mind that the small practice exemption still applies. So you could qualify for automatic reweighting for small practice status or hospital PACE status or non patient facing status. So that might apply in certain circumstances.
Can these users, Lisa, make application to be reweighted?
There might be a specific reason for reweighting in the promoting interoperability category. CMS will continue to offer the hardship application in the promoting interoperability category. So if you have a reason that you don't necessarily qualify for automatic reweighting, but you feel you have a reason why a justifiable reason for not reporting promoting interoperability, that would be a reason to reach out to your consultant and see if you qualify, and your consultant can help guide you through that process.
What other changes are we seeing in the promoting interoperability category for 2023?
So, CMS has made changes to a couple of existing objectives and measures, and also there's a new measure in place for 2023. So, under the Public Health and Clinical Data Exchange objective, they are changing the levels of engagement for those registries that you've traditionally reported on. In the past, you could get credit if you were in one of three levels of active engagement. So for 2023, what CMS is doing is they're combining the historic option one and two into pre production and validation. That used to be either you were registered waiting for the registry to respond, or you were testing and starting to get that registry link going. Um, they have the third option used to be, are you actively sending and or receiving information? What they're doing is they're calling that the validated data production level. Um, so there's no changes in being able to say that you're in active engagement. You just have to, starting in 2023, you have to identify whether you're in the pre-production and validation phase for the registries you report on, or say that you're validated data in the validated data production phase. You start to report on that in 2023, and then starting in 2024, you can only be in the pre production and validation phase for one calendar year. So that means that if you've been in a registry that you are still waiting to be up and running, um, starting with 2024, you may need to review that further to see whether that's a registry you can continue to report on. Um, we still have the five different registries you can report, two of those being required, and the three others being optional for bonus points. So I think it's most important to hone in on those two required registries to make sure that you are going to be able to continue to report effectively on those two registries. And of course, the bonus, you can continue to get bonus points if you're able to. Once again, any questions, talk to your quality program consultant, because sometimes that gets a little bit difficult to kind of sort through, and we're here to help you with that. As far as other measures, We have the query of the PDMP, which has been a bonus measure. That is now required. It is still only a yes or a no. So I think for most folks, it's still going to be something that's fairly easy for them to uh, report on. CMS has also added a new exclusion for that. Um, if the querying the PDMP would impose an excessive workflow or cost burden, they allow you to be excluded from that. Having talked to a lot of my clients, seems like that's something that folks are doing if they are prescribing the medications that are included. The CMS has also added another element to this measure. They've added, in the past, it has been that you had to query Schedule 2 medications. They've added Schedule 3 and Schedule 4. They're not doing that to add another burden to practices. Rather, they've added that so that if you've got a process in place where you're checking or querying for Schedule 2, Schedule 3, and Schedule 4, you don't have to do anything different. They've added that in so you can get credit for any one of those four types. They're not mandating that. They've also identified that there's an RX check resource for free. So we have heard from some folks that this has been a difficult thing or could be a costly thing to implement. So CMS is adding that or reminding folks about that. Um, there is a new health information exchange measure. So, this is an alternative we continue to have in the health information exchange objective. We have support electronic referral loops by receiving and incorporating reconciling health information. We have the um, sending health information, or you could report on the health information exchange bidirectional exchange measure. Or, new for 2023, you can say that you are participating in the Trusted Exchange Framework and Common Agreement program, also often noted as TECFA. We love our initials here in healthcare. So this isn't anything that you have to do above and beyond, but if this is something that you're involved in, you can get credit for that particular measure and for that particular objective. And because of those changes, adding some mandatory, the bonus measure going to a mandatory measure for query of PDMP, um, the changes that they've made over the past couple of years for public health and clinical data exchange, they have revamped their scoring methodology. So, what we're doing or what we're seeing now is that health information exchange, that objective, you're getting up to 30 points for the measures within that category. Provider to patient exchange, which was the patient portal measure, that is now worth 25 points, so it's not weighted as high as it has been in the past. And public health and clinical data exchange is weighted higher than what we've seen in the past. And that makes sense because now they've got some mandatory measures in that category. We, in our dashboard, are going to have the points and the reweighting set up so that as you add information into the dashboard, you'll be able to see those points. We also will hope to have some information shortly that would allow you to take a look at that scoring in our marketing material that we'll be sending out. So once again, any specific questions, this can get kind of tricky as you navigate through this category. Reach out with any questions you have.
Thank you very much, Lisa. That was very informative.
Great, you're very welcome.
Now we have our subject matter expert, Mary Ellen Thoma, who's covers improvement activities for us here at Mingle. Welcome, Mary Ellen. Mary Ellen's a clinical quality program consultant for us and has come from a long and varied career in healthcare delivery. Thanks, Mary Ellen. I've got a few questions for you.
Great. Let's begin.
All right. Well, what are in general the changes in the improvement activity category uh, announced for 2023?
Well, of note, there are no changes to the policies surrounding improvement activities for 2023. There are, however, changes to the inventory or list of activities that can be attested to. There are 4 new activities, 5 activities have been modified, and 6 activities are retired or removed in 2023. The net effect of these changes is that there are now 104 activities to choose from in 2023, down from 106 available in 2022.
Mary Ellen, of the activities that have been removed, which one or ones do you think have the biggest impact on our clients?
The most impactful change is the removal of PSPA 6, which is Consultation of Prescription Drug Monitoring Program. This is a high-weighted activity and one that's frequently reported on by the practices. The activity was deemed duplicative of query of PDMP, which is now a required measure in the promoting interoperability subcategory. That's important to note that that activity is no longer available in the improvement activity category, but will persist in other areas of the MIPS reporting.
Can you remind me of the requirements for improvement activities? How many of the doctors in my practice have to do them, and how much time do they have to put into it?
So the requirement for improvement activities generally is to attest to one of the 104 activities that are available for a minimum of a 90-day period. If it's part of a group submission, then 50% of the NPIs that bill under your tax ID need to be able to attest to participating in the activity.
And where has health equity shown up in improvement activities this year?
Health equity, sort of continuing a trend that we saw in last year, all the new activities are linked to one of the objectives related to the administration's plan for health equity.
And in closing, is there any general advice you have for our listeners about the improvement activities?
There are 104 possible activities to choose from. In all likelihood, you will find ones that match in activities or strategies that are happening within the practice. I think it's very important to review the data validation for the activity because that's what CMS will audit you on. Also note that the activities do change from year to year, and sometimes in a very subtle way. It can be an and replaces an or, for example. So pay attention to the data validation. Make sure you understand the documentation needed to support the activity, and choose things that make sense for the work that you're already doing in your practice.
Thank you very much, Mary Ellen. We're hearing next from Jill Hobbs. She's Mingle's subject matter expert on MIPS quality. Jill is a clinical quality program consultant for us. She has background as an RN working quality improvement in an ACO. Welcome to the session, Jill.
Thank you.
Jill, how will the quality category change in 2023?
Yeah, so the quality weighting specifically will remain at 30% of your final score, and it is will be staying that way for the remainder of the program. We have capped out on that 30%. Your performance threshold, meaning how you avoid the penalty, will remain at 75 points, so no change there. Your data completeness, and that means how the number of patients that you report on, that will remain at 70% for 2022. However, it is of note that that will be increasing to 75% in 2024 and 2025. That had come out in the final rule as well. One of the biggest changes is that there's no longer an exceptional performance bonus. So in 2022, that was the last year those bonuses will be awarded. So 2023, those will no longer be there. If you've been utilizing the web interface reporting method, that also will be sunsetted in 2022, and that's for traditional MIPS only. That will remain for APMs to have that option in 2023, but not for traditional MIPS. So web interface will no longer be an option. And lastly, for changes in quality, there are 11 measures being removed. 2 that will be partially removed, meaning they will only be available in the MVP reporting, and there will be 9 new measures for you to choose from. And that's a total of 198 quality measures that you'll have to select from this year.
Great, Jill. Thank you very much. And I also understand that after talking about it for several years, health equity is starting to show up in the rules. Where are we seeing it in the quality performance category?
We're starting to see it in the definition of high priority quality measures. So, for instance, this year we have a new measure, Measure 487. It's the screening for social drivers of health. So, that is a high priority measure, and that will count for your one high priority measure that you need to have when you select your top 6 measures, including one high priority measure. So, that is a measure that is for patients for screening for insecurities and instabilities, and different screenings for social drivers of health in general.
Jill, a handful of quality measures were removed in the 2023 final rule. Will any of those removals negatively impact our clients?
Yeah, so every time that there are any measures removed, it could impact your submission. So you always want to be watching the measures that you utilize for your submission, especially when your eligibility may be limited to only a handful of measures. There are 2 measures specifically this year for 2023 that have been highly utilized but have been removed for 2023. Those measures are Measure 110, which is your influenza, and Measure 111, which is the pneumococcal. These measures have been around for a very long time, and many clinicians have relied on these measures when they have limited eligibility with other measures. So it is of great note to take note of those 2 measures being retired for 2023.
And did you tell us where we'll still be seeing those measures?
Yeah, we do have a new measure that is coming up in 2023. It is the adult immunization status measure, but that is a measure that it will be a little bit different in that it's your influenza, your pneumococcal, but it also includes other immunizations such as tetanus, diphtheria, pertussis, zoster, those types of things. So it's going to be a group of immunizations, not just your influenza or your pneumococcal. So that will be a group of immunizations.
But we'll still see influenza specifically and pneumovax, will we not?
Measure 110 and 111 will be available in the MVP submission, but it will no longer be available in the traditional MIPS submissions.
Great. Thanks, Jill, for the great answers. You've been a big help. So next we welcome Bridget Whitney Gallagher, a manager in our client services department. Thank you for being with us, Bridget. She's a subject matter expert in MIPS Value Pathways, as well as many other things. She has a long and varied career, a true generalist. We can't pin her down to any one particular role, but she's been with us, I think, longer than anyone but me in the company.
I think so. I think so.
And colleagues says she is never stumped. So, Bridget, welcome. So, what's important to know about the MIPS Value Pathways in 2023, Bridget?
Yeah, so MIPS Value Pathways really represent CMS's response to providers and practices who are struggling with MIPS program and quality reporting in general. It is a pathway to reporting that CMS introduced last year and has really given a lot of attention to moving into 2023. They have added different pathways that someone could choose, which are kind of clusters around a disease state or specialty. They've also given us a lot more information and kind of fleshed out how they anticipate the Value Pathways program would work. So a couple important things to note for 2023, to report a MIPS Value Pathway or an MVP, a practice or provider would need to register and select the value pathway that they would like to report. You can only select one value pathway, but you can change which pathway you select until that registration opportunity closes on November 30th. You can also continue to report traditional MIPS and a MIPS value pathway. That's completely acceptable. Our understanding is you would get scored on whichever category you did better on, whether it's traditional MIPS or the MIPS value pathway. MIPS has been with us for a while here, and we know it can be challenging for folks for a lot of different reasons. CMS really has responded to some of the feedback that they've heard that MIPS is too complex. There are too many variables. There are too many choices. You can do this measure with that one and not that one, and this guy, but not that guy. And that can be really challenging for practices trying to navigate this and run a practice and see patients. So the value pathways is a way that CMS is trying to reduce that burden on practices and providers. You can report a MIPS value pathway as an individual provider, as a group, meaning at your tax ID level, or as a subgroup. And there are some details in there that would make sense to talk about if you have further questions.
Thank you, Bridget. And do you have any advice for our listeners to prepare for MIPS value pathways?
Yeah, absolutely. So, one thing I just recommend is that everybody look at MIPS value pathways, whether you think it's a good fit for you or not. For those practices or providers that are interested in reporting through MIPS value pathways, take a really close look at the value pathway that you are considering. The devil is really in the details with these. The value pathway has a limited amount of measures to select from, a limited amount of improvement activities. And so it makes sense to really dig in and understand exactly what your MIPS value pathway is requiring and make sure that that makes sense for your practice.
Great. And with 12 MVPs available for 2023, uh, is it a good idea if they're doing an MVP to also do traditional MIPS, or is that too much effort?
Yeah, so I think doing both is a great way to kind of dip your toe in the water. It is not necessarily any additional effort. Those quality measures that you're doing for your MVP and your improvement activities that you're doing for MVP, also you're doing for traditional MIPS. So you wouldn't have to make different measure selection or different activity selection. Um, and because CMS is going to score you on whichever path gives you the better score, there's really not a lot of risk. It's a great way to kind of dip your toe into the MVP arena. CMS has communicated that that's really the direction that they see quality reporting moving, and so it makes sense to get comfortable with it, get used to it, learn some of the nuances, understand how it might apply to your practice before there's a lot of skin in the game, or really before there's money on the line.
Great. Thanks a lot for all the great input, Bridget.
Happy to help, Dan. Thank you.
Now we have with us Amy Landry, manager in the client services department for Mingle, and our subject matter expert on the APM performance pathway, the APP. Before coming to Mingle, Amy had a broad and varied career in marketing, insurance industry, nonprofit healthcare clinic management. So she's been a good find for us and a great help. Uh, Amy, are you ready to answer some questions about the APP?
I am.
So, why don't we start with just in general, what do ACOs need to know about the APP transition as it applies to the 2023 rule?
Well, web interface reporting is still available, but it's going away. So it's time. Transition now. There's definitely some incentives for biting the bullet and just making the switch. CMS did, in the final rule, extend the incentive for reporting via the APP through 2024. So this means that they've lowered the quality performance threshold for those reporting via the APP to just 10th percentile for one outcome measure, and then the 30th percentile in one other measure. Whereas if you stick with reporting via web interface, you need to still have an average performance in the 30th percentile across all 10 web interface measures. Another benefit to transitioning now is a potential 10-point bonus with a health equity adjustment that they newly put in this final rule and that will also be added to an ACO's MIPS quality performance category score when they report via APP. And that's based on their quality performance and providing care to a higher proportion of underserved patients, and CMS will use an area deprivation index score to assess their underserved populations, and you won't know in advance how many of those points you'll get, but you know after they've scored everyone, they'll determine what bonus, and that will range anywhere from 0 to 10 points in that regard. But mostly, I think what we know is that if you haven't taken advantage of the gift of time CMS has given you to transition to APP, now's the time to do it. Entering the program with the reduced thresholds is an opportunity you don't want to pass up. Plus, with all the buzz that health equity is getting, it would not be a surprise if come 2025 there are new reporting requirements in that arena, and it would be a tough undertaking to begin all payer data collection, attain a quality performance threshold in the 40th percentile across all measures, and potentially new health equity initiatives all in the same year.
Thank you very much, Amy. It's been very informative.
Thank you to all of our subject matter experts for joining us on this special episode of Ask Dr. Mingle. Remember, you can always send us your questions for Dr. Mingle and the rest of our team. If you have a question, please leave it in a comment on LinkedIn or YouTube, and you can always send us an email at hello@minglehealth.com. Thank you, Dr. Mingle, and all of our SMEs for helping us understand more about the 2023 final rule.
Thank you, Hadley, and thanks for all of our subject matter experts. Remember, I want to be helpful and I want this to be useful to you. Don't hesitate to correct or supplement my answers. Share your experience, ask your questions. We can be smarter together.